Let's have a look on the frequent case of rheumatic arthritis with 10 million cases in Germany only. In joints, macrophages are activated by a lot of reasons. They produce two cytokines, TNF-alpha and interleukin-1. The first one promotes osteoclasts decomposing bone, while the latter one starts degradation of cartilage. Degradation of cartilage creates cytokines that active macrophages, a vicious circle well known by patients and physicians. The positive effect of corticosteroids is to stop this vicious circle. Instead of corticosteroids, blockers for TNF-alpha and interleukin-1 are used in therapy of rheumatic diseases. It had been expected that they have less side effects than corticosteroids. Unfortunately, these cytokines also control other processes in the body. At least a higher susceptibility of infection will result. Fortunately, there are also natural substances without side effects that can inhibit the formation of cytokines. Boswellic acid from incense inhibits lipoxygenase if applied as dimers. Curcumine inhibits COX-2, and omega-3 fatty acids form eicosanoids. What are the options for a therapy at all? Symptomatically, ASA, aspirin, against pain, inflammation and fever. Non-steroidal inhibitors of inflammation like diclofenac, ibuprofen and others. Against inflammation, partially against fever. Corticosteroids against inflammations. Or causally, systemic inhibition of TNF-alpha, curcumine, incense and alpha-linoic acid. There are many inflammations. Some of them are life-threatening, like anaphylactic shock. Fortunately, in these severe cases, corticosteroids are available. Their effects are quickly and reasonably reliable, but all of them are more or less also mineral corticosteroids, causing an excretion of potassium and magnesium and thereby edemas, the well-known full moon phase. Physicians also know that diabetes and osteoporosis are promoted by them. Frequent inflammations are of rheumatic type. Beside of emergency medicine, corticosteroids are unpopular in patients and physicians as well. The question is, can they be replaced completely satisfactorily in chronic diseases without side effects? To demonstrate inhibition of the inflammation, the laboratory method is an increased lysis of NK cells with and without the addition of interleukin-2. The used combination showed an increase by 57% and 31% respectively. In comparison to prednisolone, a standard corticosteroid, and other substances with similar effects, this combination was practically as good as prednisolone and superior to all others. In a case study in 19 patients with rheumatoid problems, 17% improved significantly, 53% improved, and 12% improved slightly. This means a response rate of 82%. 11 horses with joint problems improved, most of them permanently. Only in one case, no improvement could be seen. There was a relapse in some cases after stopping the treatment. From 21 dogs with joint problems, 16 improved, response 76%. In a second case study with 72 men, only 4% did not have an improve. This would mean an extremely high responder rate of 96%. The number is, however, too small to be significant for looking to the results. In dogs and horses, the response is better or at least equal to corticosteroids with 75 to 80%. 10 patients improved, 14 improved significantly, and 2 men were completely healthy. The time of therapy was between 2 and 8 weeks, mostly 4 to 6 weeks. There are also single cases of other indications pointing to promising therapies. Crohn's disease. 2 cases, both significantly improved, one in only 3 weeks. Beside of cortisol and its side effects, immunosuppressants with severe side effects and TNF-alpha blockers, with side effects as well, are used. This option should be kept in mind. Autoimmune thyroiditis. 1 case improved after 2 weeks. Multiple allergies, fibromyalgia, migraine. 1 case improved after 3 weeks. Periodontitis. 1 case significantly improved after 4 weeks. Coronary disease, chronic obstructive pulmonary disease, COPD. Peripheral arterial occlusion, PAO. 1 case improved after 4 weeks. Even it is only 1 case of COPD improving after 4 weeks, this therapy option should be kept in mind because inhalative corticosteroids do not work in COPD. Migraine, 4 years, 1 case improved after 2 weeks. Single follow-up studies point to the hope that these diseases that exist very often for years can be cured completely by a longer therapy. The product is a specific composition of natural inhibitors of TNF-alpha and designed as a gentle nutraceutical. By a specific administration of anti-inflammatory nutrients, it is possible to reduce or replace completely basic therapeutics like corticosteroids or analgesics. For more information, please read www.egarecipes.com. It is easy to buy curcumine, incense, and linseed oil. To get the effects, however, you have to eat an enormous quantity. Nobody is able to do this. A therapy is only possible if these substances are prepared as quantum dots. The technical term quantum dot cannot be protected and everybody can use it. The effects are only fulfilled if producers or distributors use the term produced according to Quantenpunkttechnologie Nachgradel. To be registered as a drug, 8 to 10 million euros are necessary. Look at crowdfunding of this video. As far as the figures go, each of 10 million patients in Germany would have to spend 8 euros only to make a drug available in a few years that really helps and that is much cheaper, 40 euros per month in comparison to 48 euros per year of current medication.